Hello everyone, today we'll be talking about antibiotics. So this video will be divided into about 5 or more parts. So in the first video we'll just be talking about the introduction, and in the other videos we'll talk about specific classes of drugs, okay? So let's begin. So antibiotics are a class of drugs employed mainly against bacterial infections. However, we also have some antibiotics that are used against parasitic infections. Antibiotics can have bacteriostatic, which is stopping bacterial reproduction, bactericidal, which is killing bacteria, or both mechanisms of action. So basically, it can be bacteriostatic, which is basically just prevents the reproduction, okay? And bactericidal, this is whereby you kill the bacteria. Antibiotics are effective against either a small group of bacteria, and those antibiotics are called narrow spectrum, or a wide range of pathogens, which is broad spectrum. So if the antibiotic acts on a small range of bacteria, so that will be narrow spectrum, and if it acts on a large group, that will be broad spectrum. So most antibiotics work by inhibiting cell wall synthesis, protein synthesis, or certain enzymes in bacteria. Okay. Common side effects of antibiotic treatment include hypersensitivity reactions as well as nephrotoxic and hepatotoxic effects. When we say nephrotoxic, we mean they're toxic to the kidney, and hepatotoxic means toxic to the liver. Many antibiotics are contraindicated in certain patient groups, such as in children, pregnancy, and or in breastfeeding women. In the case of severe infection, one or more antibiotics may be initiated without waiting for microbiological confirmation. That's what we call empirical antibiotic therapy to target the most likely pathogens. So, what we mean is sometimes we may not know exactly what pathogen is causing the infection. So, that's where we just have to use one or more antibiotics, and mostly the ones we use are wide spectrum or broad spectrum antibiotics. Okay, antibiotics are widely used because they're instrumental in the management of infectious diseases. However, use of antibiotics without valid indication and with inappropriate dosages and timing has led to the emergence of antibiotic resistant pathogens such as MRSA, which is methicillin resistant Staphylococcus aureus, Pseudomonas, etc. So, definition: when we say antibiotics, what do we mean? These are antimicrobial drugs effective against bacteria. Bactericidal drug, that's a substance that kills bacteria. And examples include beta-lactam antibiotics, glycopeptides, epoxides. And some antibiotics are only effective if used in combination, such as sulfonamides combined with diaminopyrimidine, streptogramin A combined with streptogramin B against certain pathogens, such as oxazolidinons are only bactericidal against streptococci, and in higher concentrations, amphenicols. Bacteriostatic drug. This is a substance that slows bacterial growth or stops bacterial reproduction. Examples of these include tetracyclines, glycylcyclines, macrolides. Some antibiotics are bacteriostatic only against certain pathogens, such as glycopeptides are only bacteriostatic against Clostridium difficile. Some antibiotics can both be bactericidal and bacteriostatic, such as Dapsone. Antibiotics that are interfering with bacterial protein synthesis target the subunits 30S and 50S of bacterial ribosomes, 70S, and they do not affect human ribosomes, which is 80S. Okay? So bacterial ribosomes are 70S and human ribosomes are 80S. So if they're interfering with bacterial protein synthesis, what they'll target is the bacterial ribosomes, and that will not affect the human ribosomes. Okay? So that's all about the introduction of antibiotics.